Hi, Sonia. Today we are talking about consequences of untreated sleep apnea. This can get pretty intense, but it is really useful information to have for our clients. So let's just dive right into it. If left untreated, what kind of issues can one see?
That's a great question. I think on one level, a lot of people think of untreated sleep apnea from like a vanity perspective. They're
Mm-hmm.
embarrassed by their snoring. They're embarrassed that they fall asleep in front of friends and family. But there, it's untreated sleep apnea has got some very serious health repercussions. In fact, one study that we looked at recently showed that untreated sleep apnea can take 20 years off of your life. In this study,
Wow.
people with sleep apnea, their average lifespan was about 58 years
Wow.
as compared to the average of 78 years. If that, a premature death doesn't get you to sit up and take notice, I'm not sure what would.
Mm-hmm.
I think understanding this idea and some of the things that we're about to talk about, it would be helpful to just think about what's happening with your body when you've got untreated sleep apnea. With untreated sleep apnea, your sleep is just constantly interrupted. Nighttime trips to the bathroom, tossing and turning, that sort of thing. If you're not sleeping well, you're not healing well. And so, getting that under control is key. But also with untreated sleep apnea, you see real sharp drops in your oxygen level, your blood
Mm-hmm.
oxygen level. At 88% or below of blood oxygen level, and you qualify for coverage through insurance of the oxygen therapy. And it's common with sleep studies that we've seen to see it in the 70s, 60s,
Yep.
50s. And so, if you were up walking around at that oxygen level, you wouldn't even be able to shut your car door. I mean, any
Mm-hmm.
exertion, your body just like shuts down when your oxygen level is at those numbers. And so this is something that people are experiencing night after night every
Mm.
time they go to bed. So over time, it's just stressing every major organ system in the body, but especially the heart. And so, conditions like high blood pressure, congestive heart failure, atrial fibrillation, where the heart is just racing out of control. These are all associated with untreated sleep apnea. But even things like stroke and heart attack. One of our respiratory therapists was talking to us about the majority of strokes occur between 4 to 6 a.m. And, if you think about it, it kind of makes sense from a sleep apnea perspective. Like, I mean, yes, that's the time of night that you're most dehydrated. So you're more susceptible to things like that happening. But also, it's the time of night when your body is most relaxed. And
Mm-hmm.
so it's common for your apneas to go up during this time. And,
And more intense.
and more intense. Yeah. So it just these one of these apneic events triggers a stroke, and you end up in the hospital. The other major impact that I think gets people's attention is the effects on the brain.
Mm-hmm.
Things like mood disorders, like anxiety, depression, but even memory loss, so like early onset dementia, even
Mm-hmm.
Alzheimer's. But going back to the mood disorders piece, I think people they don't necessarily see the impact that this has on their relationships with their loved ones. But it's no mystery, if you're tired all the time, you're irritable. But chronically, I mean, this just it changes who you are. You know what I
Mm-hmm.
mean? Your mood disorders
Yeah, night after
are
night of not good sleep. Totally.
yeah, it's impacting like your relationship with your friends and family, your loved ones. But also, you know, if you're snoring and tossing and turning and getting up a lot in the night, you're disturbing your bed partner,
Yep.
your spouse. So he or she is not getting good sleep because of your untreated sleep apnea. And it can even,
It's not just about them. Yeah,
yeah,
exactly.
it can even cause impotence,
Hmm.
So, talk about a relationship killer.
Yeah, so it's not just them; it's the people around them as well. So it's good. That's a good
Absolutely.
point. Well, that is very very good information. It's kind of scary, but we knew that that was going to be the case coming into this video. But it's still really really good information. So thank you for that. But if somebody feels like they have sleep apnea or a loved one has sleep apnea, tell them what they should do.
So yeah, Ian, it is very scary. But the good news is all sleep apnea is treatable.
Hmm.
So a lot of these effects that we're talking about, they can be prevented with sleep apnea treatments. So if you think you or a loved one has sleep apnea, the first thing you need to do is determine, are you actually at risk?
Yeah.
There is a survey out there that's used by healthcare professionals that treat and diagnose their patients every day for sleep apnea. Doctors like pulmonologists, sleep medicine doctors, even primary care doctors use this tool with their patients. So we have that survey and we would love to send it to you. So take 30 seconds, fill out the form below, and we will send you that survey so you can determine, are you actually at risk.
Hmm.
Um, if you are, don't worry. We're also going to be sending you action steps for what to do next to get to the bottom of this and get on the road to treatment and prevention of these super scary consequences.
Yeah.
And we'll also give you tips and tricks for what you can do in the meantime before you even see a healthcare professional to help minimize the effects of untreated sleep apnea. So again, though, first step, determining, are you actually at risk? So
Hmm.
fill out the form below, and we would love to send that to you.
Awesome. Appreciate your time, Sonia, as always.